This is Kirtana, ICU nurse. Today we'll discuss regarding the anticoagulants. Mainly in ICU setting, these two drugs are very common to administering the patients. The main two drugs is heparin and warfarin. So these two drugs are anticoagulants, which means they slow the clotting of the blood. The ability to clot must be carefully monitored. That is coagulation time. When a person is on anticoagulants, always take anticoagulants is anti-clotting. In ICU setting, to whom we are all administering this two drugs. For example, if the patient is having any deep vein thrombosis or atrial fibrillation, pulmonary embolism, and post-op patients like cardiovascular surgeries, on-pump CABG, off-pump CABG, any valve replacement patients, we can administer the dose of heparin or warfarin according to the physician order. So in heparin, we have low molecular weight heparin. It usually stable the response and lower chance of bleeding, like Enoxaparin. The generic name is Enoxaparin and the trade name is Lovinox. In Warfarin, we have like the generic name is Warfarin and the trade name is Comedine. The routes of administration, how we need to administer the drugs. In heparin, we need to administer IV or subcutaneous. For oral, we should not give oral. In warfarin, IV or oral. Mechanism of action is mainly for heparin. It is quick. Heparin happens fast. But the warfarin slow, hours, a week or a day. So for warfarin, you have to wait. Whether we can give this medications combined. Yes, we can give this medication combined. For pregnant mother, whether we can give heparin and warfarin. For pregnant mother, heparin is safe, and for warfarin, it is not safe for the pregnant mother because it is having a teratogenic. Teratogenic is nothing but causing birth defects or developmental abnormalities to an unborn babies. So that's what when the mother is pregnant, the warfarin is not at all giving because it will lead to harm to the fetus. Always warfarin think wait, don't give that to a pregnant person. How we need to monitor these two, heparin and warfarin? Always these two will be confusing. What the test we need to monitor? Always remember heparin is APTT, activated partial thromboplastin time, and warfarin is measured with INR, international normalized ratio. For example, if a normal patient is not on any coagulation factors, the prothrombin time will be 10 to 12 seconds and INR will be less than 1 and APTT will be 30 to 40 seconds. And this is normal people. If the patient is in any anticoagulations therapy, for warfarin, usually we will be measuring the INR 1.5 to 2 times the normal value. If the patient is having any replacement surgeries and their INR value 2.5 to 3.5. This is for warfarin. For heparin, the therapeutic range will be 1.5 to 2 times the normal value, which means the APTT is 47 to 70 seconds. As I said, measured with APTT and warfarin measured with INR. The numbers are too high, the patient will die with the increased bleeding. Numbers are too low, clots will grow. So this is the two interpretation we have to remember. What is the antidote for heparin and warfarin? Antidote for heparin is protamine sulfate. For warfarin is vitamin K. For heparin, you will need help for a pro to stop bleeding out. Heparin means prothrombin. For warfarin, vitamin K, during war, vitamin K kills warfarin. As a nurse, what is our responsibility? We need to educate the patients about the anticoagulants because the patient may have not any knowledge regarding the anticoagulants. So we need to educate the patients. First, heparin. Always I need to educate the patients to administer subcutaneous in the belly 2 inch from the umbilicus. It should always 90-degree angle. The common symptoms like bruising, irritation, pain, and do not massage injection after sight. In warfarin, we need to educate the patients to be consistent because they should not consume of more vitamin K foods as well as they should not consume too low. It should be in an equal balance of vitamin K food intake. In short, I will brief what is heparin and what is warfarin. In heparin, route will be intravenous or subcutaneous. In warfarin, per oral. Heparin, teratogenic, safe for pregnancy, does not cause any during the pregnancy. But warfarin, it will lead to the teratogenic during pregnancy or before pregnancy. Onset is rapid, heparin quick fast, warfarin slow. Monitoring the lab value for heparin is APTT and for warfarin is INR. Antidote for heparin is protamine sulfate and for antidote for warfarin is vitamin K. So at last the both increase the risk of bleeding. So always we need to advise the patients, if they are having any signs and symptoms of bleeding, need a medical attention. Thank you. Bye bye.